I'm Dr. Jason Cundiff. I'm a board-certified otolaryngologist, which is a surgeon who specializes in the medical and surgical management of head and neck disorders. I'd like to take this opportunity to discuss ear tubes. This is one of the most common procedures performed by otolaryngologists. There are two main reasons to consider ear tubes. One is for recurrent infections, and the other is for chronic fluid which builds up behind the ears and causes hearing loss. In the case of recurrent infections, we begin to consider ear tubes beneficial if an individual is having 5 to 6 ear infections in a year. In the case of chronic ear fluid, we begin to consider ear tubes if fluid has been present for 3 months and is causing hearing loss. This hearing loss can cause speech delays and balance disorders. Let's take a look over here at the diagram. So here we see the external ear, we see the ear canal, and we see the eardrum. Fluid will typically build up behind the eardrum in this space and prevent sound from vibrating through the eardrum into the cochlea, which is the inner ear. So if we can drain this fluid, many times the hearing will improve and also the number of ear infections will significantly decrease. So what we do is, through a microscope, put a small cut on the eardrum, suction out the fluid, and insert a micro tube which measures about 2 millimeters. The procedure can be performed in the office. Children require a light sedation, usually laughing gas in the operating room. The procedure typically takes 15 minutes and is done as an outpatient surgery. Most people are able to return to normal activity within 24 hours with no pain or ear discomfort. Tubes typically stay in for 6 months to 2 years and can fall out on their own. The risk for surgery is about a 1% risk of a small perforation remaining in the eardrum after the tube falls out. If this would recur, I would require a second surgery to repair this small hole. There also is a very small risk of scarring on the eardrum or the tubes falling out too soon or staying in too long. When the tubes are in place, we have to avoid dirty water from getting into the ears, especially bathtub water or lake water. This water can cause ear infections. To avoid this, earplugs can be worn to keep the ears dry. Most individuals can swim in chlorinated pool water with no difficulties without concern for ear infections. If you'd like any further information about me or my practice, please feel free to check me out at my website, www.jasoncundiff.com, or you can also find me on Facebook at Dr. Jason Cundiff.